Bailey, nurse practitioner student. Can you tell me your name and date of birth?
Jordan Andrews, 6'2", 98.
Alright, hi Jordan. Do you mind if we go ahead and start the physical assessment?
Sure.
Okay. First thing I have you do is just sit up straight. And with just your eyes, I'm gonna have you follow this pen. Alright, go ahead and keep looking straight ahead. So patient's eyes are perla. Alright, squeeze my fingers. Alright, can you take your fingers and touch your thumb to your fingers? Alrighty, throw your hands out like this and pull back against my hands. Turn and push. Alright, so patient has bilateral equal grip strength and arm strength. Next I'm gonna have you look this way for me and look that way. Look up and tuck your chin. Alrighty, and then go ahead and bite down, bite down, bite down. Stick your tongue out, cough, smile, frown, and raise your eyebrows. Okay. Patient's cranial nerves are intact. I'm gonna go ahead and just feel on your scalp, Jordan, if that's okay. Patient's hair is soft, equal distribution, and normal thickness. I don't feel any lumps, masses on the scalp. Any tenderness?
Nope.
I'm gonna go ahead and test your thyroid. Just go ahead and take a swallow for me. All right, good. Lymph nodes are okay. I noticed some keratinosis around the patient's neck. Alrighty. Next, I'm gonna go ahead and just listen to your lungs. Deep breath. Patient's bilateral upper and lower lung fields are clear, equal, and unlabored. I'm gonna go ahead and take a look at your skin back here. Palpate, no lumps, bruises, scars, or masses felt or seen back here. And then I noticed you said you had some stretch marks that you were nervous about.
Like right down here.
So patient has stretch marks on bilateral hips. No open skin though. Okay, I'm gonna go ahead and have you pull your shirt up for me in the front. Just looking, I don't see any scars or bruises or lesions. I'm gonna go ahead and feel on your chest. All right, no lumps or bruises. You can go ahead and sit back for me. I'm gonna listen to your heart.
Okay.
Patient has clear S1 and S2 with a regular heart rate and rhythm. PMI is brisk and tapping. And then I'm just gonna go ahead and look at your arms. Any pain in here?
No, ma'am.
So what I'm doing is I'm assessing the patient to see if there's any marks that could indicate self-harm. But I'm doing it in a way where the patient doesn't exactly know that's exactly what I'm doing. And as of right now, I don't see any marks that could indicate self-harm on the patient. Go ahead and tap your toes like this for me. Alrighty, and then just push out against my hands
With
with
both
your
of them?
legs, yeah. And go ahead and keep them out, and then pull back. Perfect. So patient has active range of motion in bilateral upper and lower extremities. Okay, so Jordan, the next thing that I'm going to do is we are going to do what's called a PHQ-9 assessment, and that is a depression screening tool. Is that okay if we do that?
Yep.
So basically, I'm going to ask you some questions, and you are going to fill out what they are. So how it will work is I'll ask you over the last 2 weeks, how often have you been feeling and the questions will start, and you'll answer by saying 0 or writing 0, 1, 2, or 3. 0 is not at all, 1 is sometimes, 2 is more than half days, 3 is pretty much every day.
Okay.
So the first question is going to be, in the last 2 weeks, how often have you had little interest in doing things? And you can just write your answer down. 2, how often have you, or in the last 2 weeks, how often have you felt down, depressed, or hopeless? Trouble sleeping or sleeping too much? Tired or little to no energy? Poor appetite or overeating? Feeling bad about yourself or feeling like you let your family down? Trouble concentrating? Moving really slow or being real fidgety? And lastly, how often have you had the thoughts of harming yourself or wishing that you were dead or that something would happen? All right, Jordan, you can go ahead and hand this to me. Thank you so much for answering those. I know that couldn't have been easy. So looking over the patient's PHQ-9 screening, the patient scored 18, which indicates that the patient has moderate to severe depression. So at this point, we will talk about a plan and a management strategy for the patient to get discharged from here and start at home, probably with a therapist, and get on a SSRI for depression management. Jordan, do you have any questions at this time? No? Upon assessment, patient appears tearful, a little agitated during some questions, and kind of secluded, like they don't really want to answer the questions all the way. And that is my assessment. They were well groomed and smelled fine.